SUI stands for stress urinary incontinence. This is the leakage of urine that occurs with activity, sometimes change of position, sometimes coughing, sneezing, laughing. It is not related to bladder contractions or bladder function, but the lack of being able to actually hold the urine in. Stress urinary incontinence has several causes, but the most common cause in men is the surgery for prostate, whether it be surgery for prostatic enlargement or surgery for prostate cancer. Potential damage to the striated sphincter that holds urine into the bladder usually results in stress urinary incontinence. Stress urinary incontinence is diagnosed by a proper history and physical, sometimes a cystoscopy with demonstration of straining, coughing, and position changes. A special type of tests called urodynamic studies can also be done to help measure pressures and the actual cause of incontinence. You definitely should see a specialist if you have bothersome stress urinary incontinence. The treatments for stress urinary incontinence are usually a active procedure approach. Stress urinary incontinence cannot be cured or managed adequately with medication, and so seeing a specialist to weigh various options if more conservative measures fail, such as pelvic floor therapy, etc., will allow you adequate treatment. Some treatments for stress urinary incontinence include behavioral and lifestyle modification, including weight loss, stopping smoking. Other treatments include pelvic floor therapy, which can help retrain and strengthen the pelvic floor. Some at-home exercises called Kegel exercises sometimes can improve mild stress incontinence. For more substantial stress urinary incontinence, options include placement of a sling. We have a sling for men, and a male sling can help with mild to moderate incontinence. Complete incontinence or severe stress incontinence as well can be treated sometimes with proper sling placement or placement in an artificial urinary sphincter. Which treatment option is best for a man with stress urinary incontinence oftentimes depends on the amount of incontinence, the occurrence of the incontinence, the patient's lifestyle, how much leakage occurs, whether they also have concomitant urge or overflow incontinence symptoms, the evaluation, including potential cystoscopy or urodynamics, along with a diary of episodes and amount of pads used, helps guide overall final decision on treatment options. Long-term consequences of stress urinary incontinence that's left untreated can have psychological and social impacts. Patients can have avoidant behaviors that can disrupt relationships inside and outside of the home. In addition, stress urinary incontinence that is untreated can lead to potential skin breakdown, rashes, sores, and it sometimes can increase the chance for urinary tract infections.